What if I told you that one of the most powerful natural medicines ever studied by modern science costs less than a few cents per day, has been used by physicians and healers across Asia, the Middle East, and Europe for more than 2,000 years, and that the research being published right now in peer-reviewed medical journals is confirming in molecular detail exactly why it works? What if I told you that this medicine is not in a pharmacy, that it is sitting in your spice cabinet right now? 2 cloves, that is all. 2 small dried flower buds roughly the size of a nail taken daily. And what happens inside the body of a person over 60 who does this consistently is frankly remarkable. Here's a number that puts this in context. The active compound in cloves, a molecule called eugenol, has been identified in over 100 to 300 peer-reviewed scientific studies examining its effects on inflammation, blood sugar, microbial infection, liver function, cardiovascular health, and neurological protection. 1,300 studies for a spice that has been sitting in your kitchen the entire time. In Japan, where traditional plant-based medicine has been integrated with modern clinical practice for centuries, in a system called Campo, cloves have been a documented therapeutic agent for conditions ranging from digestive dysfunction to pain management to metabolic disease. What traditional practitioners understood empirically over generations, modern biochemistry is now explaining with precision. And here is why this becomes especially urgent after the age of 60. After 60, the body undergoes a cascade of changes that make it specifically vulnerable to the conditions that cloves most powerfully address. Systemic inflammation rises measurably with age, a phenomenon researchers call inflammaging, and it is the underlying driver of cardiovascular disease, type 2 diabetes, Alzheimer's disease, arthritis, and most cancers. Digestive enzyme production declines. Blood sugar regulation becomes less efficient as insulin sensitivity decreases. The liver's detoxification capacity slows. The immune system, once aggressive and precise, becomes both less responsive to new threats and more prone to the chronic low-level activation that damages tissues quietly over decades. 2 cloves a day do not reverse aging. Nothing does. But what the research shows they do consistently and measurably addresses this precise constellation of age-related changes with a specificity that makes them one of the most relevant nutritional tools available to adults over 60. My name is Dr. Hiroshi Sato. I am an integrative medicine physician specializing in nutritional biochemistry and healthy aging. Today, I am going to walk you through the 5 most significant and scientifically documented benefits of taking 2 cloves daily after the age of 60, and then I will show you the exact methods for consuming them that maximize their bioavailability and fit naturally into your daily routine. Let us begin. Before we explore the benefits, I want to give you a brief but important understanding of what makes cloves so biochemically extraordinary, because this knowledge will make every benefit we discuss far more meaningful. The clove is the dried flower bud of the tree Syzygium aromaticum native to the Maluku Islands of Indonesia and now cultivated across South and Southeast Asia, Madagascar, and East Africa. What makes it remarkable is its extraordinary concentration of bioactive compounds packed into a structure smaller than your thumbnail. A single clove contains eugenol as its dominant phytochemical, comprising approximately 70 to 90% of its essential oil. Eugenol is a phenylpropanoid with anti-inflammatory, antioxidant, analgesic, antimicrobial, and neuroprotective properties, documented extensively in laboratory and clinical research. It inhibits the TOX2 enzyme, the same target of many pharmaceutical anti-inflammatory drugs at concentrations achievable through normal dietary consumption. Cloves also contain beta-aerophyllene, a sesquiterpene that activates CB2 cannabinoid receptors in the immune system to reduce inflammation without psychoactive effect. They contain quercetin and camerol flavonoids with potent antioxidant and anti-cancer properties. They provide meaningful amounts of vitamin K, manganese, which is essential for mitochondrial antioxidant defense, vitamin C, and dietary fiber. Most critically for older adults, the ORAC score of cloves, the measure of antioxidant capacity per gram of food, is the highest of any food substance ever measured. Ground cloves have an ORAC value of approximately 314,446 units per 100 gram. For comparison, blueberries, widely celebrated as a superfood, measure approximately 4,769 ORAC units per 100 grams. Cloves are not marginally more antioxidant-rich than other foods. They are in a category of their own. 2 whole cloves contain the antioxidant equivalent of roughly a full cup of blueberries in a package you can swallow in seconds. Benefit 1. Dramatic reduction in chronic inflammation. Inflammaging. It is the term researchers now use to describe the chronic low-grade systemic inflammation that rises progressively with age and that underlies virtually every major disease of the second half of life. It is not the acute inflammation of a cut finger or a sprained ankle which is protective and resolves quickly. It is a smoldering, persistent activation of the immune system that never fully turns off, slowly damaging blood vessels, neurons, joint tissue, and organ cells across decades. C-reactive protein, or CRP, is the primary blood marker used to measure systemic inflammation. In healthy young adults, CRP levels are typically below 1 milligram per liter. Studies show that CRP levels rise consistently with age, with adults over 65 averaging significantly higher readings than younger adults. Elevated CRP is independently associated with increased risk of heart attack, stroke, cognitive decline, and all-cause mortality. Eugenol in cloves directly suppresses the NF-κB signaling pathway, the master switch of inflammatory gene expression in the human body. When NF-κB is activated, it turns on the genes that produce pro-inflammatory cytokines, including TNF-alpha, interleukin-1 beta, and interleukin-6. The very cytokines that drive inflammaging. A 2020 study published in the journal Food and Chemical Toxicology demonstrated that eugenol administration produced significant and dose-dependent suppression of NF-κB activation and measurable reduction in all 3 major inflammatory cytokines in inflammatory cell models. A clinical study published in the Journal of Medicinal Food that supplementation with clove extract for 8 weeks produced a statistically significant reduction in CRP levels in adults with metabolic syndrome, a cluster of conditions including abdominal obesity, elevated blood sugar, high triglycerides, and high blood pressure that is extraordinarily prevalent in adults over 60 and that is driven in part by chronic inflammation. The bottom line, 2 cloves daily provide a consistent, gentle daily dose of eugenol and beta-arophyline that collectively suppress the NF-κB pathway and dampen the chronic inflammatory tone that accelerates disease and biological aging. This is not a dramatic pharmaceutical level suppression. It is a steady daily reduction that compounds meaningfully over months and years. Benefit 2. Blood sugar regulation and insulin sensitivity. Type 2 diabetes affects approximately 29% of American adults over the age of 65. Prediabetes, the precursor state of impaired fasting glucose and reduced insulin sensitivity, affects a further 48% of this age group. Combined, that means roughly 3 out of every 4 Americans over 65 have some degree of blood sugar dysregulation. This is not merely a diabetes story. Even non-diabetic blood sugar elevation in the upper normal range is associated with accelerated cognitive decline, cardiovascular damage, kidney stress, and increased cancer risk. Blood sugar management in older adulthood is one of the most consequential health imperatives available. Cloves have demonstrated meaningful effects on glycemic control through several distinct mechanisms. Eugenol has been shown to enhance insulin signaling by improving the function of blood glucose transporters. the proteins that move glucose from the bloodstream into muscle and fat cells in response to insulin. When these transporters work more efficiently, blood glucose is cleared from the blood more rapidly and effectively after a meal. A randomized controlled trial published in the journal Nutrients assigned adults with type 2 diabetes to consume either 1, 2, or 3 grams of clove powder daily for 30 days. All 3 groups showed significant reductions in fasting blood glucose, with the 2-gram group showing reductions averaging 10 to 21% compared to baseline. Serum insulin levels also decreased, suggesting that the pancreas was under less demand to produce insulin because peripheral glucose uptake had improved. The same study found meaningful reductions in total cholesterol, LDL cholesterol, and triglycerides in all 3 groups, pointing to a broader cardiometabolic benefit beyond glycemic control alone. 2 whole cloves weigh approximately 1 gram. This means that consuming 2 whole cloves daily delivers a dose in the range studied for glycemic benefit. A dose that is easy to consume, requires no supplement, and is food, not pharmacology. Benefit 3. Liver protection and detoxification support. The liver is the body's primary detoxification organ. Every substance absorbed from the digestive tract, every medication, every environmental toxin, every metabolic byproduct, passes through the liver for processing before it enters systemic circulation. In a healthy young liver, this processing is efficient and robust. In an aging liver, processing capacity declines. Oxidative. Stress within liver cells accumulates. Non-alcoholic fatty liver disease driven by insulin resistance and dietary fat accumulation affects an estimated 30 to 40% of adults over 60 and is now the most common liver condition in the developed world. Eugenol has demonstrated direct hepatoprotective or liver-protecting effects in multiple lines of research. It activates NRF2, the master regulator of the body's endogenous antioxidant defense system, stimulating the liver to produce its own protective enzymes, including glutathione, superoxide dismutase, and catalase. These enzymes neutralize the reactive oxygen species that accumulate in liver cells during the processing of toxins and metabolic waste, preventing the oxidative damage that accelerates liver cell aging and fat accumulation. A 2015 study published in the Journal of Ethnopharmacology found that eugenol administration significantly reduced liver enzyme elevations, specifically ALT and A, the markers that indicate liver cell damage in models of chemically induced liver toxicity. The researchers noted that eugenol's hepatoprotective activity appeared to operate through both direct antioxidant action and through NRF2 pathway activation. Beta-ariphyline, the secondary bioactive compound in cloves, has also demonstrated significant anti-inflammatory effects specifically within liver tissue, reducing the hepatic inflammation that drives the progression of non-alcoholic fatty liver to the more serious non-alcoholic steatosis, a condition associated with cirrhosis and liver failure. For adults over 60 taking multiple daily medications, each of which adds to the liver's metabolic processing burden, the hepatoprotective and antioxidant support provided by cloves is particularly timely and practically relevant. Benefit 4. Digestive health and gut microbiome support. Digestive function declines reliably with age. Gastric acid secretion decreases, reducing the stomach's ability to break down proteins and absorb vitamin B12 and iron. Digestive enzyme production from the pancreas and small intestinal wall diminishes. Gut motility slows, contributing to the constipation that affects over 40% of adults over 65. And the diversity of the gut microbiome, the community of trillions of microorganisms that regulate immune function, mood, cognitive health, and metabolic efficiency, decreases with each decade of life. Cloves address multiple dimensions of digestive aging simultaneously. As a carminative, cloves reduce the formation of intestinal gas, and relieve the bloating, cramping, and discomfort of flatulence by relaxing the smooth muscle of the gastrointestinal tract and promoting the expulsion of gas. Eugenol has anti-spasmodic properties that calm the involuntary contractions of an irritated gut wall, making cloves one of the most historically well-documented remedies for digestive discomfort across virtually every traditional medicine system in the world. Eugenol also demonstrates potent antimicrobial activity against pathogenic bacteria, including Helicobacter pylori, the bacterial strain that colonizes the gastric mucosa and is strongly associated with peptic ulcer disease and gastric cancer in older adults, as well as against various Clostridium and Salmonella species. A 2020 review in the International Journal of Molecular Sciences confirmed that eugenol disrupts the cell membranes of pathogenic microorganisms while demonstrating selective activity that spares beneficial bacterial species, a property called selective antimicrobial activity that is rare among natural compounds and pharmaceutical antibiotics alike. Research also suggests that cloves stimulate the secretion of digestive enzymes including lipase, AMA, and protease from the pancreatic and intestinal cells, directly addressing the enzyme insufficiency that impairs nutrient absorption in older adults. Better enzyme activity means better extraction of nutrients from food, reduced digestive discomfort, and more efficient caloric processing. For an older adult struggling with post-meal bloating, irregular bowel habits, or the vague digestive discomfort that so often accompanies the natural decline of gastrointestinal function with age, 2 cloves taken daily, particularly 15 to 20 minutes before a meal, can produce measurable improvements in digestive comfort within 1 to 2 weeks. Benefit 5. Bone density support and joint protection. Osteoporosis affects approximately 20% of women and 5% of men over the age of 50 in the United States. Osteopenia, the precursor stage of reduced bone density short of full osteoporosis, affects over 40% of postmenopausal women and a significant proportion of older men. Vertebral fractures, hip fractures, and wrist fractures from osteoporosis are among the most common causes of disability, loss of independence, and premature death in adults over 65. Cloves contain manganese in meaningful concentrations. 2 whole cloves provide approximately 30% of the recommended daily intake of manganese, making them one of the most concentrated dietary sources of this mineral available in ordinary food. Manganese is an essential coactor for the enzyme manganese superoxide dismutase, a critical mitochondrial antioxidant, and it is directly required for the synthesis of the connective tissue matrix that gives bone its structural integrity. Eugenol has demonstrated direct effects on osteoblast activity, the bone-building cells responsible for laying down new bone matrix. A study published in the International Journal of Molecular Sciences found that eugenol significantly stimulated osteoblast proliferation and differentiation while simultaneously suppressing osteoclast activity, the bone-resorbing process that drives the progressive bone loss of osteoporosis. This dual effect, stimulating bone formation while suppressing bone breakdown, is precisely the mechanism targeted by the pharmaceutical bisphosphonate drugs prescribed for osteoporosis, albeit through different molecular pathways. For joint health, the anti-inflammatory properties of eugenol and beta-arophyline are directly relevant to osteoarthritis, the most prevalent joint condition in adults over 60. Osteoarthritis is driven by inflammatory degradation of the cartilage matrix within joints. By suppressing the NFKB-mediated inflammatory cascade that activates the matrix metalloproteinases responsible for cartilage breakdown, cloves' daily consumption contributes to a lower inflammatory environment in joint tissue, potentially slowing cartilage degradation and reducing the pain and stiffness that limit quality of life in so many older adults. 2 cloves daily deliver manganese, eugenol, and beta-arophyline in a combination that simultaneously supports bone formation, suppresses bone resorption, and reduces the joint inflammation that makes movement painful for millions of adults over 60. Knowing the benefits is only half of the equation. How you consume cloves determines how much eugenol and the other bioactive compounds your body actually absorbs. Let me walk you through the most effective methods ranked by bioavailability and practical ease. Method 1. Whole cloves chewed slowly. Most bioavailable. The simplest and most bioavailable method is to take 2 whole dried cloves, place them in the mouth and chew them slowly for 1 to 2 minutes before swallowing. The act of chewing ruptures the cellular structure of the clove and releases the essential oil directly into the oral mucosa, the richly vascularized tissue of the mouth, where eugenol is absorbed rapidly into the bloodstream without needing to pass through the full digestive process first. The taste is intensely aromatic, warm, slightly numbing on the tongue due to eugenol's mild analgesic properties, and deeply familiar. It is understandably an acquired preference for some people. If you find the intensity too strong initially, try 1 clove and build to 2 over the first week. Best timing, first thing in the morning, 10 to 15 minutes before breakfast. The empty stomach maximizes absorption, and the eugenol begins suppressing inflammatory pathways and stabilizing blood sugar before the first meal of the day introduces glycemic and inflammatory stimuli. Method 2. Clove water. Gentle and highly practical. For those who find whole cloves too intense, clove water is an extraordinarily effective alternative with excellent bioavailability. The preparation is simple. Take 2 whole cloves and place them in 250 milliliters, approximately 1 cup of water at room temperature or slightly warm. Allow them to soak overnight for a minimum of 8 hours. In the morning, remove the cloves and drink the water on an empty stomach. The overnight steeping process extracts eugenol and the other water-soluble bioactive compounds into the water in concentrations that deliver therapeutic effect. While the intensity of flavor is significantly gentler than chewing whole cloves, the resulting water is lightly fragrant, subtly spiced, and easy to drink for virtually anyone. Alternatively, you can bring the water to a gentle simmer, not a boil, with the cloves for 5 minutes. Allow it to cool and strain before drinking. Boiling is not recommended as it can degrade heat-sensitive phenolic compounds. You can enhance the benefits of clove water by adding a small piece of fresh ginger, half a cinnamon stick, or a squeeze of fresh lemon. Ginger adds its own anti-inflammatory ginger rolls. Cinnamon adds blood sugar regulating cinnamaldehyde. Lemon adds vitamin C and citrate. The combination becomes a powerful daily morning tonic. Method 3. Clove powder in food. Most seamlessly integrated ground. Clove powder available in any supermarket can be incorporated into food and drinks with virtually no disruption to existing eating habits. Half a teaspoon of ground. Cloves contains the equivalent bioactive content of approximately 2 to 3 whole cloves. Add it to your morning oatmeal with cinnamon and a small handful of walnuts. Stir it into a smoothie. Mix it into a warm glass of milk, dairy, or plant-based with turmeric and black pepper for an anti-inflammatory golden milk variant. Sprinkle it over roasted vegetables or into soups and stews, where its warm, slightly sweet depth enhances the flavor profile naturally. The key consideration with ground cloves and food is heat. High cooking temperatures above 180 degrees Celsius will degrade eugenol and reduce the therapeutic potency of the spice. Adding ground cloves to already cooked food, stirring into a finished dish, or incorporating into warm rather than hot preparations preserves far more of the bioactive content than adding to a high-temperature cooking process. Method 4. Clove tea. Ideal for digestive benefits. For the digestive benefits specifically, clove tea taken 15 to 20 minutes before a meal is the optimal delivery method. Crush 2 whole cloves lightly with the back of a spoon to crack them open, releasing more surface area. Place them in a cup and pour water that has been heated to 85 to 90 degrees Celsius, just below boiling over them. Steep for 5 to 7 minutes. Strain and drink slowly. This pre-meal ritual allows the eugenol to reach the stomach and upper digestive tract before food arrives, priming the digestive enzyme secretion, calming the smooth muscle of the gut wall, and beginning to create the antimicrobial environment that protects against pathogenic overgrowth. For older adults who experience bloating, heaviness, or discomfort after meals, this practice can produce noticeable improvement within 1 to 2 weeks of consistent use. As with any bioactive substance, context matters. 2 cloves daily is a safe food-level dose for the vast majority of adults. However, several populations should exercise caution and consult their physician before beginning daily clove consumption. If you are taking blood-thinning medications such as warfarin or clopidogrel, be aware that eugenol has mild anticoagulant properties that may potentiate the effect of these drugs. This does not mean cloves are forbidden, but your physician should know you are consuming them regularly so they can monitor your coagulation markers appropriately. If you are scheduled for surgery, discontinue clove consumption at least 2 weeks prior, as eugenol's anticoagulant properties increase bleeding risk during surgical procedures. Adults with known liver disease should consult their physician before consuming cloves daily, as very high doses of eugenol, well above the 2 clove daily level, have shown hepatotoxic effects in animal studies at pharmacological doses. At the 2 clove level, the hepatoprotective research is reassuring, but physician guidance is appropriate for those with pre-existing liver conditions. Pregnant women should avoid consuming cloves in quantities beyond normal culinary amounts. 2 cloves daily exceeds normal culinary use, and the safety of therapeutic clove consumption in pregnancy has not been established. For healthy adults over 60 without these contraindications, 2 whole cloves per day is a food, not a drug. It is safe, evidence-supported, and has been part of traditional dietary practice in populations around the world for millennia. 2 cloves every day after 60. Chronic inflammation suppressed through eugenol's inhibition of the NF-κB pathway. Blood sugar moderated through improved GLUT for function and insulin sensitivity. Liver cells protected by NRF2 activation and antioxidant enzyme stimulation. Digestion supported through enzyme stimulation, carminative action, and selective antimicrobial protection. And bone and joint tissue reinforced through osteoblast stimulation, osteoclast suppression, and anti-inflammatory cartilage protection. 5 distinct biological systems, all supported by 2 small flower buds backed by over 1,300 scientific studies available in every supermarket in the world for a few cents a day. The aging body faces a specific, well-characterized set of challenges: inflammaging, glycemic dysregulation, declining detoxification capacity, digestive inefficiency, bone and joint vulnerability. Nature, it turns out, addressed all 5 of these challenges in a single plant. Long before pharmaceutical science had the tools to understand why it worked, traditional physicians across Asia were already prescribing it. Modern biochemistry has simply given us the molecular language to explain what 2,000 years of clinical observation already knew. Start tomorrow morning. 2 cloves, chew them slowly, soak them overnight, steep them in hot water, or stir them into your breakfast. Choose the method that fits your life. Be consistent. Give it 30 days. Pay attention to how you feel. The benefits are not dramatic in a single day. They are the kind that build quietly, steadily, daily, the way all lasting health is built. I am Dr. Hiroshi Sato. Thank you for watching. If you found this valuable, share it with someone over 60 who deserves this information. Subscribe for more evidence-based nutritional medicine content and take care of that remarkable body of yours. It has carried you this far. Give it what it needs to carry you further.